I won't even look at an MRI until I do my evaluation. I was taught that by one of my mentors, and it was great advice. So it sometimes would aggravate patients, but I'm like, I'm just not going to look at it until I actually ask you all the questions, do my own evaluation, do my own physical exam, and then I'm going to tell you what I think, and then we're going to look at the MRI and see if it adds up. But often, you're right. I think also you have to think about and consider who's that MRI report going to, right? And do those people have any clue about physical medicine, first of all? If they're an orthopedist, hopefully, obviously, they know how to evaluate joints. I'm not saying they don't understand physical medicine, but they don't understand conservative care, physical rehabilitative medicine the way that you and I do. And I know we have different training, but still similarly, like we're getting the patient moving, we're getting the patient active, we're impacting the nervous system so that the tissues can move more freely. Like there's all kinds of things going on here that I don't think that the person receiving the MRI report probably has an appreciation for. What do you think about that?
So like you said, chiropractic and PTs, like we do the same thing in terms of getting people moving and loading tissue and doing that whole rehabbing someone, right? We may have different methods, but the goal ultimately is the same, of getting people moving, getting people to reacclimate into activity in their life. And again, no shade at doctors, and this is not all doctors. I know some doctors are phenomenal and truly actually take the time to learn about physical rehab, but most doctors in your general setting, in your general, whether it's a hospital, even a private practice, so many osteopaths, surgeons, they don't understand rehab whatsoever, or their understanding of rehab is from a failed perspective. They know rehab is going to fail because traditional PT and traditional methods of chiropractors don't work. Like your run-of-the-mill PT and your run-of-the-mill chiro, you will see no changes. Or if you do, then your issue is that minor, and all it needed was a little bit of some kind of outside influence, and it can get better on its own. But for so many people, like most of my patients, they've seen 3, 4, 5 other therapists, and I'm the sixth one, and the final one, but the sixth one, right? And so, but that's healthcare. So either the osteopaths or the doctors that people go to, they like you said, are not informed about physical rehab, or they have such a low expectation of the physical rehab space that it almost doesn't matter. They know they're going to have to go for surgery anyway because rehab is going to fail, and they're going to convince the patient that they need it because traditional rehab failed.
It's really sad because it's so many unnecessary surgeries occur, and people don't understand that surgery is a big deal. I mean, the surgical route, and then it destabilizes the joint further. And often, from my point of view, because I was in the realm of prolotherapy and regenerative injections, and so it was a lot about treating the enthesis points, which is where ligament, as the audience doesn't know, but where the ligament and tendon meets bone is the enthesis. And when you inject those areas, even with a low dose of dextrose, it can often stop the pain. And so much of the work I did revolved around the patient. I'm trying to put back together a joint that is slowly but surely just decompensating because it is deconditioned. And half the time I would just look at them and say, go to this strength and conditioning gym where I trust these people because they train older folks often, and go get strong. Go spend your money there. Do not spend your money on injections. Go get strong. Go put some shelves on those shoulders, and those shoulders will stop hurting.
Yeah.
And 9 times out of 10, it worked. It worked great. And it's just too bad that the system at large, well, I think we're also looking at a lot of doctors who are not fit themselves. And that's something I always appreciated about you. I was like, oh, he's fit, he's mobile, you're a dancer. You guys, if you don't follow Dr. Shapiro, you must, because he dances in almost every single video, and it's so fun. So
thank you.
That's the key, right? And so we're talking about docs who are deconditioned themselves, or they're like cardio bunnies and they don't believe in strength and conditioning. And, it just gets arduous for the patient. I'm sure it's frustrating, but at the same time, it's 9 times out of 10, people just need to figure out how to regain some level of fitness in that region.
Yeah, and just getting better guidance. I mean, to that point what you just said, I have a patient whose PCP, my patient went to them hey, my knee hurts. I really want to be able to bike and swim and hike. I really love being active. And she's in middle age, about 50s or so. And the doctor looks at her and goes, why? Just chill. You're getting older. Stop doing stuff. What? Oh
Oh,
my God.
no.
Oh my God. I told her immediately, get a new PCP, get
Yeah.
a new doctor. Forget it. You know, that's crazy. Like, oh, you're getting older, do less. In what world would you need to do more, if anything?